Hello, ladies and gentlemen. Thank you very much for joining me today in this live webinar on understanding and treating hypertension according to Ayurveda. In this webinar, we're going to cover, first of all, and the most important thing, the causes of your high blood pressure. This is what you need to do. This is what you need to write down and take notes on during this webinar. Don't think you're going to figure out how to treat your high blood pressure by just taking hibiscus tea, or just taking a little garlic, or reading on social media how to treat your high blood pressure. Whoa, as we say here in Texas, when the horse is going too fast, you need to slow down and you need to first diagnose why you have high blood pressure. What are the causes? So we're going to go through all these causes first. We're going to break them down into Vata Pitta Kapha because this is, of course, their doshic imbalance in Ayurveda. It's not a disease. These are symptoms of doshic imbalances in systems in the body, and I'm going to explain that. And then, of course, we'll talk about diet, but of course, the diet is different. We're going to break it down to 3 different types: Vata type of high blood pressure, Kapha type of high blood pressure, and Pitta type of high blood pressure. So there'll be 3 different diets. There's no one diet for high blood pressure. There's no one diet for any condition. Everybody's an individual. Everybody's different. All these fads you hear about are all fads. Don't listen to anybody who's coming out and telling you this is the best diet. I can tell you that now things are the opposite of reality. When you go on and try to look at a weight loss diet, they're telling you to eat meat all day. This is the worst thing you could ever do. And then when you go talk about high blood pressure, people are telling you to have chili pepper and tomato sauce. The worst thing you could do. So the information online is like backwards. Maybe they've censored all the good information, so only the bad information has come to the top. I don't know, but it's not good. The information out there is terrible. And even if people who had experience and knew what they were doing were on this social media, they still couldn't help you because they don't know you. Only if somebody diagnoses you, asks you questions, feels your pulse, understands your lifestyle, your habits, your stress, of course, your age, your medical history, and of course, your diet and all these supplements and medicine that you could be taking. And all of it has to be looked at and analyzed to determine, is any of this increasing the person's blood pressure? And you'll be surprised. A lot of things you're doing every day are increasing your blood pressure, and you don't even know it. And some, you know it, you're just not taking it seriously. Like insomniacs, they're always telling me they have 1 cup of coffee. And sometimes I say, get your spouse. The spouse comes, I say, how many cups of coffee is your wife having? Oh, she's having 2 or 3 cups of coffee. See, so, people are often in denial. This is a big problem with people's health. Denial. It's the biggest obstacle to improving your health. I mean, people know me as my profession is helping people with their health, and they'll introduce me to somebody else, and I'll ask the person, how you doing? How's your health? I'm fine, all good. And of course, my line is, well, God bless you, because I haven't ever diagnosed an adult that didn't have health problems. So you must be quite special. But what we're really talking about is a lot of people are just in plain denial. They're not accepting they have the health problem at all. Or they're taking the meds and thinking, well, now they have no health problem because they're taking the meds. Anything could be further from the truth than that. Because I get people all the time, they were taking meds for 10 years for blood pressure, and now they have to take another med. Now they're on 3 meds, and their blood pressure is still high, and they're coming to me, and I have to keep them on the meds and add herbs on top to get their blood pressure down. That's because they never removed the cause 25 years ago. So the pathology has been continuing now for 25 years. They've been taking the meds, they've been masking over their symptoms, but they haven't improved, changed the causes. They haven't removed what's causing the problem. So of course it's continuing to go, and eventually they're going to have to get a double, heart bypass, and open heart surgery, even though they've been taking the meds for 20 years. So the med didn't fix anything. You still end up getting the surgery at the end and maybe dying from a stroke, or taking 2-3 meds that have all types of other side effects. We're not talking about that approach. Everybody's free. If that's the approach you want to take, you just have to do it with open eyes and realize you're not treating anything. You're not improving your cardiovascular system. You're staying alive for a little longer and creating more problems down the road. We're talking about identifying the causes, removing the causes, and then treating the imbalances in your systems, your circulatory system, your nervous system, or your cardiovascular system, to improve your cardiovascular system. So that's why when you're a herbalist, you only have to give the client herbs for a few months, maybe 1 year, or some small amount of herbs to keep maintaining the healthy cardiovascular system. You don't take herbs forever. People always think, oh, it's working. I'm taking your herbs and my blood pressure's down. Now I have to take them forever. I go, no, if everybody took my herbs forever, I'd be a billionaire. But they don't. They take them a few months, give me a testimonial, thank me, and they're gone. So, and I have to go find new clients because, we're resolving these health problems. So that's where we're going to start: the causes, the types. Then we're going to talk about the diets. Then we're going to cover the herbs. Okay. But again, it's all based on the type. So let's break it down to 3 general types of high blood pressure. Vata type. Vata, we know, is active, quick, moving, light, dry, rough qualities. So a Vata type person is thin, light, dry, nervous, sensitive, gas, bloating, constipation, doesn't sleep well. This type of person, thin, we know this type of person. And so what's causing their high blood pressure in most cases? Stress, poor sleep, anxiety, constipation, creating pressure. So even constipation, people don't take it very seriously. Oh, I'm fine. My bowel movements are normal. And they're not going every day. They're going every couple of days, and they got high blood pressure, and other types of digestive problems. I mean, there's a long cascade of problems that come from constipation. But any blockage in the system, blockages in your circulatory system, cold hands, cold feet, dizzy, lightheaded, all are symptoms of poor circulation. So, but the main cause for Vata type of blood pressure is related to your nervous system. Stress, anxiety, they go see the doctor, their blood pressure goes up. They get in the car, the blood pressure goes up. The ex-wife calls, ex-husband comes, blood pressure goes up. So it's related to the nervous system. So when you get this white coat syndrome, when you go see the doctor, blood pressure is high, he gives you meds, you go home, you take it, relax, get a little massage, and listen to some music. No meds, you take your blood pressure, it's down. That's the Vata type. It's going up and down and up and down. That's Vata type of high blood pressure. Now, unfortunately, a lot of people are taking medicine for this when they really could focus on removing these causes, lowering the stress, improving the sleep, getting off of coffee, getting off of stimulants, getting off of chocolate, and all these type of things that are aggravating their nervous system. So the Vata type is based on the nervous system of affecting the cardiovascular system, affecting the heart muscles. Even when you get these heart palpitations, racing heart, that's it. That's the nervous system is behind the high blood pressure. Now, of course, I'm breaking this down into 3 simple categories, but many people can have 2 of these categories together be the cause. So that's only the first category, the Vata type. Second type is the Pitta type. Now, Pitta type person with high blood pressure, they get the red face, the red ears. When you see red ears, blood pressure's high. When you see these veins bulging out here on the temples, blood pressure's high. I see people, they're just coming in the clinic. I can tell their blood pressure's high just by seeing them walk in with the red hair, red eyes, bulging little veins on the side here, red ears, and sometimes even a whole red face, but definitely the ears get red. And this type of person, what's increasing theirs? Heat, hot things. They drink alcohol, blood pressure goes up. They have spicy food, blood pressure goes up. They get angry and mad, the blood pressure goes up. You know how when people get angry, they become hot-headed and their blood pressure is going up. I mean, but remember the Pitta type, Vata type person, this when they're stressed, then their blood pressure goes up. But no, the Pitta type is when they're angry and mad, which is their tendency anyway. So they're mad at work, they're honking the horn, they're having road rage, and their blood pressure goes up. So anger is the main thing. And this is a killer type of blood pressure because there's often inflammation in the arteries. So this inflammation is there. Chest pains, that's the Pitta type. And there's inflammation. Usually there's muscle pain, tenderness, joint pain. And these people often are tough guys, in denial. They have muscle pain, chest pain, red face, high blood pressure. Who cares? They just keep on going, but they're the type to have a stroke and die quickly too. And this type of blood pressure is very dangerous. It can go up and down, but it never goes down much. It stays pretty high. And there's usually a lot of other symptoms of inflammation. There could be irritable bowel, acid reflux, heartburn, ulcerative colitis, stomach ulcers. These could all be together. Nobody just has, one health condition. People who think their health is fine, I could find half a dozen health issues with them. And people come to me all the time, daily, for high blood pressure. And usually they have other issues too: digestive issues, stress issues, anger issues, muscle inflammation. But so to treat this type of inflammation, this type of pitta type of high blood pressure, you have to reduce inflammation. We're going to cover those diets in a minute, and we're going to cover the herbs for these three types. The third type is kapha type. Kapha, of course, is heavy, dense, slow, sluggish. And what's that? That's when the fat level gets too high in the body and the blood. So obesity, high salt, swelling. There's a lot of swelling. And then, of course, high cholesterol numbers up to like 300. 220 isn't going to kill you or block your arteries, but you get around 300 of your total cholesterol. This gets quite dangerous. So, high blood fat, high body fat, obesity, signs of swelling. These are also another cause. Now, there is other causes. These are the three main categories. There's also, you could have kidney problems, kidney disease. This could be another cause, and even alcoholism, drug use, and many medications can affect your cardiovascular system as well, but that's outside the scope of this talk. So now we're going to review the diets quickly for these three types. Vata type, nervous. Blood pressure goes up and back down, up and down, even down to normal. Pitta type, it definitely stays up, can come down a little bit, but it's never coming down much. It's like going up 170, 180, and then it can come down to 130, 140. But kapha type doesn't go up very high, but it stays there. It's very stable because it's due to the blockages in the thick blood and the sluggish system and sluggish lymph and sluggish circulation. So you can even tell by the examples, just by asking people, measure your blood pressure in the morning, evening, night, you can already tell what type it is. But most people, they know, if you're obese and you got high cholesterol and your numbers aren't going up high, not going down low, and they're just staying steady, they're not coming down, you could even have a blockage in your arteries. So of course, the diet's going to be very different for all three of these. The home remedies are going to be very different. The herbs are going to be very different because they're completely different causes. So let's start with the Vata one first, which is related to your nervous system. First thing you have to remove, and really for Pitta or Vata type, you have to remove coffee. Coffee is, it's making the heart go faster. I don't know how many people, I must get a person once a week who's got heart palpitations and racing heart, but they're still drinking coffee. Nobody tells them to stop drinking coffee. So you got to get off the stimulants if you're having stress, not sleeping well, and have high blood pressure, and you're a sensitive person. You can't be doing coffee. You can't be doing green tea. You can't be doing Red Bulls. You can't be doing all these stimulants because your whole nervous system is the cause of your stress, your anxiety, and your high blood pressure all together. If you come see me, I don't just treat your high blood pressure. In this case, I'd have to get you sleeping good. I have to get the insomnia down. I have to get the stress down. I have to get the heart rate down and keep you calm. And that will probably resolve your high blood pressure. In fact, in many cases, the blood pressure was not very high, but going up and down. So I just gave them relaxing tea. We also call it chill out tea. But and this chill out tea was enough. I remember sometimes people even ask me, how come you just gave me relaxing tea? And I say, well, that's because the whole cause of your blood pressure issue was due to the stress that you're creating. And that stress is what's been pushing up your blood pressure. So all you have to do is relax. Sometimes I'll give people, so say if you're this type, I'm just not going to give you herbs, which we're going to talk about. First, I get rid of all your stressful things. No more watching the news. No more talking politics. No more coffee. No more chocolate. No more Red Bull. No more stimulating things. Getting to bed earlier. I'll give you not only give you herbs to bring your blood pressure down that are relaxing herbs, relaxing your heart muscle, but I'll also give you herbs for stress, give you herbs for to relax in the evening, and give you herbs to sleep, because it's all connected. And then people say, wow, how come I stopped the sleeping herbs and the relaxing herbs, but I'm taking the blood pressure herbs and my blood pressure went back up? That's because part of the treatment for this type of person is the relaxing herbs and the sleeping herbs. It's all together. So now you can see why these advice on social media is so terrible, because there's people telling you to have coffee for your blood pressure, and they don't know what they're talking about. And because they don't know who they're talking to. Maybe for them it worked, and we will see for the kapha type, they can do some coffee and it won't hurt their blood pressure. But let's go on to the pitta type. Now, the pitta type, the qualities of pitta are hot, sharp, a little oily, right? So what are they? And they have a susceptibility to inflammation. So this person has got inflammation, muscle pain, high blood pressure, and there are often anger issues, drinking issues. So this person has to get rid of the alcohol, has to cool down, can't be so angry. We have herbs called cool heads to cool them down, chill them out. See, chill means cool, chill out. And then, of course, they have to do cooling things. We're going to get into like coconut water, anti-inflammatory herbs. So this person, usually I'll give them herbs for the heart, high blood pressure, that are anti-inflammatory. In the first type, I give herbs for the high blood pressure that relax the heart muscles. And this type, I give herbs that relax, lower the inflammation in the arteries. And the whole body, I may give them an anti-inflammatory formula that just lowers the whole inflammation in the body. Just like for the vata type person, I'm going to throw in who's got nervousness is the cause of their high blood pressure. I'm going to throw in relaxing tea and sleeping tea along. With this pitta type of person, I'm going to throw in anti-inflammatory herbs and cooling herbs. Cooling, he's hot. Remember the guy, he's got the red face, the red ears, he's angry, he's getting mad, his blood pressure is shooting up every time somebody cuts him off on the road. So we got to get him off the alcohol. We got to cool him down. Cooling herbs like coconut water. But you got people on Facebook telling you to take chili pepper for your high blood pressure, which will make this type much worse. So this type, we tell them no, cooling herbs, sweet fruit, and people have the obsession sometimes with fruit, like, oh, all fruit's bad, also no, but not for this type of person. If you're obese and you have high blood sugar, you can't be eating bananas. But if you're a vata person, thin person, bananas are good for high blood pressure because of course, we know the potassium and they're very calming and everything like that. But here for pitta type, we usually give sweet fruits like dates and mangoes, no citrus, no lemon, no lime. And we can see people thinking lime's a treatment for high blood pressure, but not this type. This type needs sweet taste because to make them sweet and calm, and they get hangry easy. When they get hangry, they can even get their blood pressure up. So again, this person needs to stay calm. They need to be angry. They need to have 3 meals a day. They shouldn't be fasting. They should have cool things, sweet things, coconut water, anti-inflammatory herbs, and really try to avoid anything that can make them angry and upset. But of course, the herbs are going in to the arteries, breaking down the plaque, reducing inflammation in the tissues, opening up the channels, and actually doing the treatment. Remember, removing some of these causes like not being stressed or not being angry isn't going to get rid of your high blood pressure. It's just going to keep it from not going worse and not progressing. You need the herbs to be the heavy lifters to get in there and clean the arteries out. We're going to get to those next, particularly this next type, the kapha type. This kapha type, it's caused by high cholesterol numbers, obesity, blockages in the body, swelling. And they need to go on the low-fat diet, not no-fat diet. Don't anybody do the no-fat diet, and not the no-salt diet, even though it's a low-salt diet. It's a good salt diet. There's a little bit of, rock salt. It's okay. It's that sodium, that table salt that's so terrible, and processed foods. This type of person eating too much processed foods with bad fat and bad salt is it created obesity, swelling, and high blood pressure and high cholesterol, mostly due to their diet. So the diet is very important with this kapha type. Well, it's less important with the vata type. Now, kapha type, he can do some garlic because he's got the plaque buildup, the fat. He's where the garlic treatment comes from. But remember, you can't be giving garlic to the guy who's got the anger and the heat and the irritability and the strong appetite. No, garlic is going to make him worse and shoot up his blood pressure. And you can't imagine how many people already tried that and learned the hard way. So, but this type, kapha type, they can have apple cider vinegar, they can have lemons, they can fast, they can do garlic, they can do olive oil. These are all perfect for this type of person. They should be on a kapha pacifying diet, which means no meat, almost no animal protein at all. Well, that vata type person, you can't be doing this person 2 meals a day or their stress will go up. You can't even do them on a vegetarian diet. You have to give them some animal protein to support their nerves. And they actually need a higher fat diet because that fat is supporting their nervous system. So, all 3 types take a different approach. Let's cover the herbs because the diet should be based on their doshic imbalance, vata, pitta, kapha, and the cause of their imbalance, which I just covered the 3 main types. Now, there are other causes, including kidney failure, and there's 8 or 9 different causes, but these are the main ones. And even in these, you can break them down and you can have combinations. Many people have vata and pitta imbalance, creating their high blood pressure, or kapha and pitta. They're heavy, overweight, plus hot and angry. And then other people are thin and nervous, plus hot and burning up and angry. So you can have a combination of the 2. So that's what makes it a little trickier. In fact, here's one formula right here. And we have different formulas for different combinations. And this one is just for that type. See the VP there? That means it's for the vata pitta type. See, so we have types just for pitta, just for vata, just for kapha. And this one is for vata pitta, which is really one of the most common types. And we can see improves cardiovascular function, controls blood pressure, improves circulation. And then we can see the herbs here are very Arjuna, the premier herb for circulation and high blood pressure and thinning the blood. Shank Pushpi, a very calming herb. Gota Kola, related to Brahmi, calming too, but also good for the circulation. And then Sarpaganda. This is probably one of the most effective and less popular herbs, or less known, I should say, for high blood pressure, but it really lowers the pulse. And very effective. Jatamatsi, a calming herb. We use it a lot. That's for the vata. Abrakbasma is like a catalyst. It's making it all work together. And Taruni is rose petals. So that's for the pitta. See, so there's some herbs for the vata, some herbs for the pitta, some herbs for the cardiovascular system, some herbs to clear the arteries, and all working together. These herbs are working as a team. You cannot say, oh, I'm just going to take Arjuna. Oh, I'm just going to take hawthorn leaves. No, I mean, you need a team. It's kind of like a commando unit, they all have different roles in the group, or even a football, group. You have the forward, you have the goalies, you have different people playing different roles. That's what herbs do. That's why 1 or 2 herbs are never proper. You always have a little group of herbs and they're all working together. In this case, we needed herbs to balance the vata, to keep you calm, keep you relaxed. We needed herbs to balance the pitta, to make you cool and bring down the body temperature. And then we needed herbs to open up the circulation and clear the arteries. Now, of course, the big boy there is Arjuna. But if there's more anxiety and there's a racing heart without high blood pressure, we have this one, calm heart. This one's much more for vata. There we go. And you can see heart palpitations, poor circulations. There's Arjuna again. See, that's the key herb. That's for the cardiovascular system, the circulation. But this one is a little simpler. Nothing for pitta. Jatamatsi, calming, warming. Gota Kola, calming, circulatory. Cinnamon, kind of a catalyst, making them all work together. It's just for little racing hearts, or as they call AFib. We take care of it all the time with that formula. It's amazing. Usually I'll combine it with a calming formula as well. Now, if you do have cardiovascular blockage in the coronary arteries, for example, we have, which is mostly a kapha condition, but it could be pitta kapha, it could be vata kapha. So this is for blockages, mostly in your arteries. And you can see there's Arjuna again, the key herb, but this one is backed by resin, gugulu. And Saraswati is, most people know it as for mentals, but memory. And Saraswati is the name of the Indian god for knowledge. So we use Saraswati straight just for, dementia and memory. But it's also used for circulation, opening up channels. Fenugreek, very heating, breaking up. Pushkar Mool, we use for respiratory congestion and blockages. Shilajit is an unblocker. Abrak you people are starting to learn about Shilajit. Abrak is a catalyst, and there's that Gota Cola again. But this is a hot, strong, powerful formula for mostly a Kapha type. It's probably too hot for the Pitta type, but it's unblocking things. It's going to help the circulation over the whole body. In fact, even with that Saraswati Churna in there, it's going to even help your memory. I mean, many people say, wow, not only did it unblock my arteries, I didn't have to do a surgery, my memory got better, and my varicose veins went away. That's because it's not a pill just keeping your blood pressure down. It's improving your circulation in your whole body. And that's why you get in, and even opening up the channels in your brain. Now, here's another tab we have, and mostly we use these for the Pitta type. We just call them heart tabs. And it's called Muktavati. Mukta means pearl. So these are for, they will also use them for antidepressants, believe it or not. It's very effective. Lowers blood pressure, but this is for the Pitta type. And it helps with stress and irritability. See that irritability? And it's got the powder of pearl in it. They're very calming, very cooling. So if you're a Pitta type person, I'll throw these in, particularly if you got irritability issues. And then I usually throw in my heart tea because people like the teas. The teas taste good. But remember, tea isn't going to be very powerful. People think they're going to lower their blood pressure, by just, having garlic or hawthorn berries. Well, I'm treating people every day. It just isn't enough, maybe in the early stages for prevention. But I give out this heart tea, which is better than probably most teas you're going to find in the market anyway. And it's not even enough. But it's made for cardiovascular problems. And you can see the main ingredients are hawthorn leaf and hawthorn berry. But the other main ingredient is motherwort. Motherwort's famous for high blood pressure. There we go. And then lemon balm is, of course, from the mint family, very cooling. There's ginkgo. This is one of the oldest trees in the world, and the leaves are helping for circulation. Motherwort, well known, famous for relaxing the heart muscles. Hawthorn leaf and the berry, both together. This is the premier Western herb. Butcher's broom is clearing the arteries, breaking up plaque. We also use it for cellulite. Oat straws for the nervous system. Dandelion root, rosemary, and ginger are kind of supportive. This is a fantastic tea. And I usually give this along to all three types. And because this helps, that hawthorn leaf is known for clearing out the arteries. And if people drink it 2-3 cups a day, it can make a big difference. So I think you can see how I'm treating people so effectively. One, I get rid of all their causes because they're causing it. Coffee, chocolate, inflammatory foods, not sleeping, fatty foods, bad diets, like, paleo diet and all these fad diets out there. Those are usually making problems. Sometimes they're losing weight and making other health problems. But I'm removing all these. And a lot of supplements people are taking are creating high blood pressure. They're taking ginseng. They're taking green tea capsules. I got a lot of these energy drinks, formulas that give you all this energy. Oh, they're using green tea extract in them. And this is pushing up people's blood pressure. And then they don't sleep well, which makes a secondary problem. So you can see why I'm successful. I full diagnosis, spend 30-40 minutes figuring it out, get a big questionnaire first. Then I get rid of I diagnose it, which type they have, what are their causes. Then I ask them to get rid of all these causes, not overnight, but they at least have to be aware of them and start getting rid of them if it's stress or inflammation or blockages, Vata, Pitta, Kapha. And then I give them herbs that are actually improving that condition. And then I back it up with some teas to drink all day long to keep it down. And then even once the blood pressure gets down, then I leave them with some tea and just keep doing the tea. And I do get, I've been in practice for over 20 years. So I get people coming back after 5-10 years with the blood pressure coming back. But that's because they went back to their old habits again. So, you can't be going back to your old habits that caused it in the first place. So I hope you understand that, you got the point that you can't be taking, just following advice randomly online. I don't even use hibiscus tea. I mean, maybe I could be putting a little hibiscus in my heart tea, but it's working fine. But just the hibiscus tea is not going to be enough to bring your blood pressure down, even if you just drink it all day long. Now, it's a healthy tea, it's a cooling tea, it's helping thinning the blood, it's a flower, so it's got good benefits. But for some people, it's going to be nothing, not going to help one bit. Other people who are like pitta type, it's going to help. See, once you know the type of person, then I can say, okay, that will help you. Or somebody says, oh, can I take garlic? Well, if they're the pitta type, I'm going to say no, it's going to make it worse. If they're the kapha type, I'm going to say yes. If it's apple cider vinegar, I'm going to say not for pitta, it's for vata. And bananas, people are drinking bananas because they got potassium. I said, oh, you can't just take a food just because of one nutrient. So I always tell the ladies, that'd be like marrying a man just because he has high testosterone. That's like eating a banana just because he has potassium. There's a little more to a man than his testosterone. I'm sure the ladies that like a man with a little testosterone, and we like our bananas with a little potassium. But we can't just pick a man or a fruit or vegetable just based on one nutrient. It's foolhardy. There's more to a man than his testosterone, and there's more to a banana than his potassium. Bananas are fattening, heavy, clogging, and even can lead to, constipation. But if you're a skinny little vata, thin, nervous, and you're underweight, a banana is good for you for your high blood pressure. So it all depends on your causes, your constitution, who you are, vata pitta kapha. You could be vata pitta, you could be pitta kapha, you could be kapha vata. There's any combination. And you could be a vata person with pitta high blood pressure. You could be a vata pitta person with kapha high blood pressure because you ate junk food for 10 years and now you're obese. But inside you're still getting anxiety and stress, but you're also now obese with super high cholesterol. So now you have a vata imbalance plus a kapha imbalance. And I don't go a couple weeks where I don't find somebody with all three. They're hot, burning, acidity, muscle pain, inflammation. That's the pitta. Then they've got the stress, the anxiety, the poor sleep. That's the vata. And they're obese, heavy with high cholesterol. So they have all three doshas are imbalanced. And now they wonder why they're taking 3 meds and their blood pressure is still not down. Well, I know why. Once I can bring down the vata first, then the pitta, then the kapha one at a time, then their blood pressure will be coming down because that's the underlying cause of all these imbalances. Now, of course, again, I will repeat, there are other causes to high blood pressure, such as kidney failure, and we are simplifying it here, but you should look at these 3 types. Anyway, I hope that helps you understand that there's plenty of I wouldn't say plenty of treatments. I got to be careful there. An experienced seasoned herbalist with herbs can easily treat you as long as the diagnosis is correct. Now, even though I've been in practice for a long time, sometimes I meet a person and I may be misdiagnosed. The blood pressure doesn't come down. The condition doesn't get better. So I go to the next appointment. I do another appointment and I re-diagnose. I go, oh my God, I didn't see the pitta. I didn't see the vata. I didn't even know they had kidney failure. They didn't tell me. Now I can treat that. That's why sometimes if they got a lot of urination at night, the kidney creatine levels or the GFR numbers aren't bad, I may throw in some kidney herbs, particularly if they're swelling, and that can help bring down the blood pressure. So these are like supplemental. If they have some kidney issues and swelling and nocturnal urination, I'll throw in the kidney tea. If they're stressed, then I may throw in the relaxing tea, sleeping tea. These are all supplemental herbs on top of their main treatment, but it's all together how it works. You just forget this whole concept. What do I take for my blood pressure? That's the wrong question. You need to be thinking, why do I have the blood pressure? Because once you know why, then you can go from that direction. And that's the way I have to work. That's why people call me, oh, you treated my uncle. Can you just send me the herbs? I say, no, I don't know who you are. I don't know your condition. I don't know what you're eating. I don't know your health history. And in my mind, I don't know what's behind your high blood pressure. And I don't know whether it's vata, pitta, kapha, or a combination. So you got to remove this from your mind, which is all over Facebook. Facebook is just full of people just giving out advice and trying it and guessing and doing all kinds of things. It's a mess. It's a mess. And people get confused. And a lot of times they're doing things that are not in their own health and not in their own interest. Okay, ladies and gentlemen, thank you very much. I hope I've made my point. I hope I've inspired you, to understand that, this type of treatment is very, very effective. And unfortunately, it has a bad name that people don't think that these natural treatments work. And that's not because natural treatments don't work, because the practitioner themselves is guessing and not diagnosing. Diagnosing is more important than the treatment. Once I have the diagnosis down, I could pick Chinese herbs, Western herbs, home remedies. Once I got the diagnosis exact, I know the herbs, I know the diet, I know home remedies. I could give you Western herbs, Indian herbs, Chinese herbs. But if I have the wrong diagnosis, then, I'm just guessing. All right. Please contact me if you like help with your health in any manner. I'd be happy to evaluate your case. And as you know, you can book a free appointment on my website for 30 minutes, no cost. You have to fill out my form so I can see what's going on. And then I will discuss with you about your case, and I will tell you all your health problems in less than 30 minutes. I won't treat them in 30 minutes. But if you fill my form out, I'll tell you all your health problems and mostly the causes for free. And then at that point, we can just go forward if you want at that time or at a later date and actually do the treatment, the diet with the herbs. And then you can actually be treating your health conditions, improving your cardiovascular condition instead of just masking it over and taking a medication that's just going to leave you with more symptoms and possibly regret down the road. Once again, ladies and gentlemen, God bless you all, and I hope to hear from some of you and from my friends and family that are listening. Thank you very much for your support. All right.